Good evening, everybody. So I'm going to be talking to you now about navigating the health system in Israel. Despite the interesting times and trying times that we're all in at the moment, I'm delighted to have the opportunity to be able to speak to you about the health system that we have in Israel. And of course, if you do have any questions about coronavirus, I will try and answer them. Now, first of all, some rules. I would request that if you have questions about things, forward them to us in the question box, and at the end of the presentation I will leave time and I will address your questions. If you have questions which are more clarifications, things you don't understand during the presentation, then send them to me and we'll try and answer you as the presentation goes on. Okay, so we're going to start. My name's Tanya Cardash. I'm a family doctor and I'm the Deputy Regional Director of Maccabi, and I've been working with Nefesh B'Nefesh for many years now, explaining about the healthcare system in Israel. First of all, let me give you a little introduction so you know a little bit about the country you're coming to. In a survey of 48 countries in 2018, Israel's health system was actually ranked 4th in the world in the terms of efficiency. In 2017, Israel was ranked the 6th healthiest country in the world by the Bloomberg ratings. Now, these ratings take into consideration also the lifespan of a person, also the diagnoses of chronic conditions, cancer, and also, of course, the economic management of the healthcare system by the health funds. Israel is also a world leader in medical research. Over half of Israel's scientific publications in a year are actually medically based. The industrial sector here uses the knowledge to develop new pharmaceuticals and treatments. Many of you may know that Teva is one of the largest producers of generic medications in the world. Israel is a leader also in stem cell research, which is really something at the front line. And of course, has to be said, we hopefully will be the first ones to produce a vaccine, which seems to be in the oral form for the coronavirus. We've already got a team of scientists in the north of Israel who had been working on a vaccine for coronavirus in poultry, which is now being adapted for use in humans. And we hope that within the next few months, that's going to be available and we'll be able to sell it worldwide. Now, I want to explain to you a little bit about how the healthcare system works. First of all, it's a system where all of the residents of Israel are covered. There's a comprehensive basket of services, which is the same for whichever of the 4 health funds you are members of. Every year, there is a committee that sits and decides which services that year will be included in the health basket. And the health basket is a mechanism where things are only added on and things aren't taken away. Then all of the health funds are obligated to provide you with the treatments which are in the basket. Now, how is this basket funded? It's funded from 2 streams. It's funded from the money put aside by the government, which is given to the healthcare, and also Israeli citizens pay a certain amount of the national insurance payments towards healthcare. Now, that's something which is, as if someone is employed by an employer, it's something which is deducted at source, a tax deducted at source. And if you're self-employed, then your accountant will help you make the necessary payments every month. It's a tax which is based according to how much you earn. So if you earn more, you pay more, but everyone at the end of the day has the same right and benefits of taking things out of the system. Now, when you first make Aliyah, if you're not working, you're actually exempt from paying the national insurance payments in the first half year or year once you're here. But from the point where you start working and earning money in Israel, you will have to start paying national insurance contributions. Now, as I said to you before on the previous slide, it's a universal system. Everyone in Israel is covered. There is no age limitation, no health limitation. There is no exclusion for pre-existing illnesses, and there is no waiting to join as long as you are an Oleh Chadash. If someone is a Toshav Choser or has another status, then that's something where your Aliyah advisor can help consult you with. But what I'm saying at the moment about there being no waiting period is true for Olim Chadashim. Now in Israel, as I mentioned previously, there are 4 health funds. There's Maccabi, Klalit, Mu'chedet, and Leumit. Now also, you may remember I said a few slides ago, the basket of healthcare services they offer are equal. So you don't need to start shopping which fund is going to offer me this medication and which one isn't. So you decide which health fund to join by a number of factors. First of all, where you're going to be living. I strongly recommend that you consult either with myself by mail, and I'll give you my email at the end of the presentation, or with people who are already living in the area, or with the Nefesh B'Nefesh advisors. And they will tell you which of the health funds are strong and have a large presence in the areas where you're going to live. Your decisions might be based on which hospital you would like to get treatment at, or you've heard of a specific doctor that you would like to work with. That might be another factor that is something that you consider before making the choice. Now, let's say you've chosen to join one health fund and you realize afterwards that you want to change. That's not a problem. You can change. From 6 months after you have made Aliyah and joined, you are eligible to move over to another plan. But of course, we do recommend as soon as possible to find a plan which is good for you and suits you, because that enables a continuity of care with the doctors that you've got to know. Now, I've built here a little pyramid to explain to you how the system works in Israel. Now, what I've been explaining to you until this point is the basic healthcare. That's what's offered to you by all of the 4 health funds, and that's what your national insurance contribution goes towards funding. Now, on top of that, there is an optional level of care, which is called the supplemental health insurance. This is called different names in different health funds. It's called in Mu'chedet C, in Maccabi, Zahav, or Sheli. And this is basically allowing you to top up your basic insurance with the health funds. Now, this again is without exclusion for age or pre-existing conditions. It's a nominal fee. The price is dependent by according to your age category, and the highest is about 120 shekel a month for someone over the age of about 80, and for a child it can be something like even 6 or 7 shekel a month. Now, this is something which is more like topping up your insurance to what you might have experienced when you were abroad as private insurance. For example, you need to have a surgery and you choose to have it with a private surgeon or in a private operating clinic. It means that you can have rehabilitation in certain units if, God forbid, you've had a heart attack or a stroke. It means if you were hospitalized, you would be entitled to take a private nurse to sit with you. If you're pregnant or after childbirth, there's financial benefits that you can gain. You can also have discounted baby care and baby supplies, which you can buy with this. I'll come on a slide in a few minutes. I will also explain to you some other benefits. We then come to the 3rd tier and the highest tier, which is an entirely private insurance. That's a scheme which is offered to you by private insurance agencies, and some people take those out to top up the things that they feel are missing in the healthcare system, which could be if you choose to have a surgery abroad, because let's say you've got family still living abroad. If it was a surgery that could be done in Israel, then the Israeli health system wouldn't cover you to go abroad and have it done. But you might prefer to have your hip replacement closer to your loved ones abroad. And then if you had private insurance, that might cover it. Another reason some people take out private insurance is to get approval for medications which are in only trial or experimental stages. If you have, let's say, a very rare or advanced condition that isn't responding to conventional treatments. Now, I'm going back now to the bottom tier again, and I'm explaining to you what the healthcare basket includes. It includes doctor's visits, blood tests, imaging tests such as CT scans, X-rays, MRI, hospital admissions and surgeries, paramedical treatments such as occupational therapy, physiotherapy, speech therapy. Dental care until the age of 18 or over the age of 75 is also in the healthcare basket, and also mental health care. Now, I'm very often asked questions about what is the cap or how many treatments am I entitled to a year. Now, we don't have that concept in Israel. If a doctor feels that you need to do 4 MRIs a year, you will be approved to do 4 MRIs a year. The allocation is based according to your need and not according to a ceiling where once you've hit the maximum, you can't get any more care. Now, services not included in the healthcare basket are dentistry aged 18 plus and under the age of 75, optometry, and chronic nursing care. Now, by optometry, I'm talking about glasses and contact lenses. I'm not talking about you seeing an eye doctor to get your cataracts treated or to get your glaucoma controlled. Chronic nursing care we will also come to in a few minutes and I will address. Now, in Israel, your primary care doctor, which is generally your family practitioner or your pediatrician, he is your case manager. Now, you do have a direct access option to some specialties, such as orthopedics, obstetrics and gynecology, ophthalmology, dermatology, and ENT. But I do recommend, especially for orthopedics, that you go first of all and you see your primary care doctor. The reason for this is that nowadays things are very much subspecialized. If in the past an orthopod dealt with all bones in the body, nowadays you'll have one orthopod who specializes in backs, someone else in knees, and someone else in arms. Another advantage of seeing your primary doctor first is that he can refer you to the necessary imaging scans or blood tests before you consult with the doctor. This makes your consultation with the orthopod far more fruitful. There are other specialties which I haven't listed here which require a referral from the family doctor. That would include maybe a hematologist, an endocrinologist, and a neurologist. The reason being for that is that, again, your primary doctor can make sure that you have done the adequate imaging tests and blood tests before you go and see that secondary care specialist. Now, the specialists which I'm talking about, and I mentioned you before, are generally located in the clinics and the medical centers in the community. In Israel, the system is very much based to bring the specialists to the community rather than the patients going to the doctors. Now, if you have something which is considered rare, or maybe something which requires inpatient admission and consultation before that admission, you may be sent by the doctor or a specialist in the community to the outpatient clinic. Now, if you're sent to the outpatient clinic, you will be asked to bring a special referral, which is called a Tofes 17, a Form 17, or a Hitzchayvut. Hitzchayvut is from the word obligation. That means the health fund is obligated or has agreed to pay for any treatments or any costs that you may incur while you're in the care of the hospital. How do I make an appointment, you might ask? Now, most people today now use the application, the online services, but still for the people who prefer to speak to someone, there is a 24-hour call center with multilingual capabilities which works in all of the 4 health funds. Or of course, there's the traditional way of speaking to the clinic receptionist and asking to make an appointment with your doctor. All of the health funds now also have internet sites where they provide information in many languages on the rights and benefits. There's also a personal section with your health record, reminders maybe to do your mammogram. If you've got slightly high sugar, you might find their recommendations on how to reduce your sugar, on recommended exercises. You can also request from your primary care doctor prescriptions, sick notes, referrals. This is a system now we're really seeing coming into its own in the days of Corona, where patients, especially those with chronic conditions who don't need to come into the surgery, can actually send requests online to their doctor, and their doctor can send them straight to their home or to the pharmacy, the medications or the referrals they need, without them having to come to the clinics and expose themselves to potentially people ill with Corona. Again, on the internet site, you can order directly from the pharmacy. Pharmacies are already starting to deliver medications to people's homes, or you can also take out travel insurance if you go away. An important point to remember, it's often asked of me, is travel insurance. Now, the Israeli healthcare system covers you while you are in the borders of Israel. If you go away, you have to take out travel insurance if you aren't still a member of a plan back at home. Again, as with most things that we are familiar with, if in the past we used to use the computer and internet sites for things, nowadays there's applications which allow us to do exactly the same things. On the application, you've got a GPS location directory so you can find where the GP is you're going to find, or any other service. You can get your lab results in real time. You can produce a list of your medications. There's a pregnancy management application so someone can see what stage of development their baby's at that point in time and what tests they need to be doing. And also I myself as a physician very much benefit by the fact that I have a mobile application that allows me to check up my patient's blood results or x-rays while I'm at home. So if I feel that there was something that needed checking up on and I'd left the office, I have access to all this information. Now, let's say one's not feeling well out of hours. The clinics generally start working at about 7:30 in the morning and finish at about 7:30, 8 o'clock at night. Now, there is a 24-hour helpline in all of the 4 health funds that you can call up. There are nurses staffing that helpline, doctors back them up. I myself work as a doctor backing up the Maccabi helpline, and they will give you advice as what to do. Obviously, if you're at home and someone's collapsed in front of you, or God forbid you think they've had a heart attack or a stroke, you don't need to call the helpline. You straight away call the emergency line 101, which is the number in Israel for the emergency ambulance services. But the 24-hour helpline, if they feel that your case can be dealt with in one of the urgent care clinics in the community, or maybe even a doctor could come and see you and solve the problem, then they would advise you to do that. The whole reasoning behind this 24-hour helpline is to direct people to the most efficient place for them to get their needs serviced and supplied. Now, let's say someone is in need of home care. Now, I'm talking here about the fact that the patient needs home care, and not because it's convenience. Because, of course, our system is stretched thin sometimes, and we have many people who are getting older with chronic illnesses. We can't let patients choose to have home care because, for example, they don't have a car at home and they can't get to the clinic. The home care is something which is based on according to need. Now, that could be a short-term period of time. For example, someone's had a hip replacement. They need to come and have their wounds checked. They need physiotherapy at home for the first few weeks. But the whole picture is that they should be back on their feet soon and able to return to their regular clinic. Or it might be something longer term. Maybe someone's wheelchair bound, maybe someone's got Alzheimer's, someone's got dementia, and it's really too difficult for them to get out to the clinic. In those situations, then they will be allocated a team of healthcare professionals who will be their home care team and follow them up. In Israel also, we separate the well baby care from the ill baby care. Pregnant women and infants and children from the age of birth to 6 years of age are actually given care and follow-up in what's called tipat chalav, which means a drop of milk. They get their immunization, they undergo screenings for common healthcare problems, including doctors assessing them at certain milestones. The mother gets nutritional advice, there's lactation consultants there. And of course, there's people who are giving education on hygiene and dental health, and of course, safety and the importance of putting children correctly in car seats, how to prevent accidents at home. Now, if you remember the pyramid I presented to you a few slides ago, we're now jumping up to the second tier, the middle tier, which is the supplemental health insurance. Now, again, as I mentioned, it's optional, but saying that about 90% of the population in Israel actually take it out because of its low cost. There are no exclusion criteria. Anyone is eligible to join, even if you make Aliyah and you're over the age of 100. There are normally 2 or 3 tiers of plans available, each one costing slightly more, but giving you slightly more benefits. I mentioned before also the cost is according to age. It goes from a few shekel for someone under the age of 5 to maybe a maximum of 120 shekel a month for someone over the age of 80. The benefits vary very slightly between health funds, but generally they are the same. But what is an important point to note is for Olim, you have a 90-day period of following your Aliyah where you can join to not have a waiting period. If you were an Israeli citizen and you didn't have the coverage and you then chose to join, you would have to have a waiting period for some of the benefits. This basically is preventing a situation where people are only joining an insurance plan when they want to actually take out some of the benefits, because if that was the case, then the plan wouldn't be financially viable and wouldn't be able to survive in the long term. Now, some examples of services which you can get in the supplemental insurance are medications which might not be included in the healthcare basket, but are discounted at 50% generally if they're added on to the supplemental policy. It allows you to consult and get a second opinion with specialists, generally departmental heads in major hospitals or deputy departmental heads at a very low cost, normally at about 200 shekel. The health fund pays 80% of the cost and you just pay a very low co-payment of 20%. It allows you to choose to have a surgery or an operation at a private hospital. There are discounts on complementary healthcare treatments, reflexology, acupuncture, Chinese medicine, tweener, and of course, the discounted dental care and treatments for those who are over the age of 18 and under the age of 75. Now, I'm going to mention here very quickly, because again, even though it's not related to the healthcare system and is covered by the Bituach Leumi or the National Insurance Institute, I'm very often asked about it. Disability benefit is something which is available to all of the Israeli residents who are in the working age population, which is over the age of 18, but under the age of retirement. Now, if you are someone who has a disability recognized abroad, it is important to bring with all of your paperwork and assessment from abroad. They can be in English, of course, but you will have to go through the committee to get it recognized here in Israel. It will not be something which is automatically given to you. Again, nursing care. Nursing care is another field which isn't given by the health funds, but it is something which you need to know about. Now, the medical care to a nursing care patient who is at home is, of course, supplied by the health fund. As I explained to you, if a patient was homebound, we would go in, the doctor would visit, the nurse would visit. But that doesn't include the day-to-day caring of the patient, helping them wash, helping them feed, and helping them move around the home. Now, a nursing care patient is considered someone of retirement age or over who is suffering from a medical condition that requires assistance performing the basic activities of daily living. These include washing oneself, dressing oneself, feeding oneself, toileting oneself, and transferring from bed to chair. Now, a complex nursing care patient is basically an add-on category to this, that as well as unable to perform these daily functions, they need constant supervision by a doctor. These patients are normally in nursing homes. Now, if you were recognized as someone who is entitled to nursing care coverage, the National Insurance Institute will fund up to 18 hours of home care per week. Generally, someone will come in twice a day, once or twice a day, for a few hours at a time. Now, there has been until now nursing insurances through the health funds, and as well as private policies. I'm not going to go into them too much now, because in the past few months there have been reforms going on about these nursing care policies, and it may no longer be possible for people to join them, but we will know more in the coming months. If you have an existing nursing policy from abroad, check very well before you cancel it whether it's worth you hanging on to it. Some of the policies allow you to still claim benefits from them, even if you're not living anymore in America or Canada. Now, what to bring with you? It's very important that you bring with you your medical records, your vaccination records. Bring with at least a month's supply of medications, not because you won't be able to access the doctor immediately, but you have so many things to organize and deal with when you arrive. You don't want to have come just with a week's supply of medication and be stressed to have to get hold of your medication straight away. It's very important to bring with you hospital discharge summaries, and if you've had any surgeries, to bring the notes. And of course, if you've got discs of CT scans, mammograms, bring them with you, because these serve as a point of comparison for future tests which are done. Now, again, I'm going to mention very slightly the cases of a katin chozer and an ezrach choleh, but I do urge you to consult with your aliyah advisor. Now, a katin chozer is an Israeli citizen who has left Israel before the age of 14 with at least one parent and is now coming back to Israel. They are entitled to medical care immediately, but they do have to get the necessary paperwork from Bituach Leumi on arrival. An ezrach choleh is an Israeli citizen who has been born abroad to one parent who has held the ability to transfer Israeli citizenship to the child at the time of their birth. He is also available for coverage straight away. The category which you really need to speak to your aliyah advisor is a toshav chozer, which is a returning citizen, which means someone who left Israel over the age of becoming an adult and is now coming back. They may be given a waiting time before they can join the health funds, and in such situations, there are a few options which we can offer. One option is you can pay privately into the health funds until you are released, as it were, from Bituach Leumi, or of course you can approach an insurance agent and you can take out a private policy with them. Thank you very much for listening to me. I hope it answered some of your questions. Now we will go over to the questions in the question box that I've received. So first of all, I'll read out the question and then I'll give you the answer. Now, I've been asked, what do you recommend for dental insurance for people in middle age? Now, in all of the health funds, the highest dental coverage is the highest level of care. I would recommend the difference between the plans are maybe 20, 30 shekel. I would recommend, if you think you're going to need dental coverage and insurance, take out the highest level. Dental insurance is available for citizens aged 19 to 74. It's included in the supplemental policies. Now, medical devices, I've been asked, such as insulin pumps, yes, they're included, they are covered. There is a ceiling, a co-payment that is paid for medical devices every month. It's a relatively low co-payment. It's about $40 to $50 every month. And that's the maximum. Even if you were to take $300 worth of equipment, you would pay no more than the fee I mentioned. Of course, if you took out less, you wouldn't pay anything. You wouldn't pay that higher ceiling. You would just pay for what you've taken.
We asked about hearing aids. If you want to just include that on.
Hearing aids as well is something where actually there have been a whole new contracts released recently. Hearing aids, there is a very high co-payment if you have the supplemental insurance. Hearing aids generally cost quite a few thousands of shekel, and for a few hundred shekel, you're entitled to change your hearing aid. It depends, it's more often for children than for adults, but there's also intervals how often you can replace them. Now, how long are the waits to see a specialist? Now, that's a very hard question to answer. If it's urgent, your doctor can get you in to see a specialist quickly. If someone comes to see me today and I need them to be seen urgently by a specialist, I can pick up the phone and I can get them in urgently. If it's something which isn't urgent, it might take a little longer. It depends on the field, it depends where you're living. And generally, it's not more than a few weeks. Now, of course, one of the advantages, if you have the supplemental level of insurances, then you can choose to go and see one of the listed specialists via the private insurance, and that can expedite the process of seeing a specialist. Now, I've been asked here about medical marijuana. Now, this is a question which is very important to understand. Licenses which you may have abroad are not transferable to Israel, and it is illegal for you to bring medical marijuana into the country. So if you are someone who is taking medical marijuana or medical cannabis, you are going to need to go through the process of licensing again in Israel. I know that's something which isn't easy for some people, but that's the way it exists. It is also the same the other way around, that if someone from Israel was coming to America, their license for medical cannabis wouldn't be recognized. They would have to go through the same process there. Try and think of it as such as a driving license or a license to practice medicine. I can't pick up and go and practice medicine in America without going through the whole licensing process to do so there. English availability on the websites is far better than it used to be. On the health funds, you can go in, all of the sites now transfer into English, and there's a lot of information that you can find. I've been asked very specific questions. I'm going to provide my email at the end. If someone has a question about specific medical problems, I don't really feel this is the right place for me to address them. You're welcome to send me an email. But again, in general, we have any specialist that you would have in America, sorry. You know, if someone has multiple sclerosis, of course, we have neurologists and we have specialist centers for multiple sclerosis. If someone has Crohn's or ulcerative colitis, of course, we have gastroenterologists who will follow up and will see the patients. Okay. Okay. Private insurance covering pre-existing conditions. Generally, private insurance plans don't cover pre-existing conditions, but that isn't my field. So that's something that you have to speak to one of the private insurance brokers about. Now, I've been asked the approximate cost per month for a retiree. Now, if you're retired, your national insurance contribution, which doesn't actually include only healthcare, it includes other benefits as well, I believe is at about 130 shekel a month. Now, let's say at that stage when you're in your 60s, it's about 100 shekel a month to top up your insurance to the top level. You're talking about $60 or so each before the co-payment on medications to get healthcare for the retired person. Now, with regard to private insurance, as I mentioned, you should speak to the insurance brokers, you should go online and you should see, but you should make sure that you are not doubling up on coverage. You should make sure they are only offering you plans which are giving you over and above which you've already got covered. Now, I've been asked to give a brief update on the coronavirus. That's something which is very difficult to do. Israel has its way of dealing with it, which I'm quite involved with from my position here, and America has its way. Israel has closed its borders. Israel has asked people to be as much as possible close to their home, to have as little contact with other people as possible in the attempt to stop us peaking at a very high number of cases, and also allowing the medical system to cope with those people who need intensive care and medical care. The idea is if they come to the system slowly, the medical staff will be able to deal with them and give them intensive care beds before the system gets overwhelmed. Of course, it's worrying times for us all, but I do believe that within 6 months from now, we will have a vaccination for it. I think maybe we will change some of our habits, some of our foreign travel, some of our integration with other people. We might think twice before being in very large crowds, but I do believe that we will get back to a new status quo not too far from now. Now, I've been asked here about speech therapies for children. Of course, child development, as I mentioned to you before, a child goes through the Tipat Chalav system. If he is diagnosed with any developmental delays, or if his family doctor or pediatrician feels he has something which needs treatment, then he's referred to a speech therapist or to a physiotherapist if necessary on the system. Of course, someone can go privately to get these sessions and treatment, but it is available on the system for you. Now, people wanting to know the specific costs for health insurance, if you go onto the websites of the health funds, you will see the costs broken down there. Generally, $10 to $15 for an adult between the age of about 25 to 40, and about $2 to $3 a month for a young child. So for two parents and a child, maybe something like, and two children, maybe $50, $60 a month. But check online. All of the health funds have got tables which have the age and the price of the plans. Okay, now if someone has a child who is disabled over the age of 18, then again, you need to speak to your Nefesh B'Nefesh representative. Sometimes there is a way of getting the paperwork over here and a file started before you've actually arrived in the country. But please speak to your Aliyah advisor, your pre-Aliyah advisor, on how to deal with that. Okay, do you have any more questions to come in? Okay, with regard to hearing aids, I think I mentioned hearing aids are something which is subsidized very highly by the health funds. In Israel, you would be seen in a hearing center. Your hearing test has to be done in one of our hearing test centers, which don't work with the supplies of hearing aids. This is something which we're very, we believe is the right thing to do, because this way we separate the incentive from people who run hearing centers to maybe make the tests seem worse than they are, to convince people to buy hearing aids. So if you are eligible for a hearing aid, that would mean your hearing test has been done in somewhere which does not sell hearing aids, so has not got any incentive to diagnose you as someone who needs a hearing aid. Now, can you make Aliyah while coronavirus precautions are still going on? You can make Aliyah. Nefesh B'Nefesh will help you with that. I know even in the health fund where I work, we've set up a system whereby normally people need to physically come to the branch to register. At the moment, we're saying that if someone has made Aliyah and they have to be isolated or quarantined at home for the first 14 days, we can be in touch with them and immediately join them up to the healthcare system, and then they can come by and sign the paperwork once they finish their 14 days quarantine. Orthodontists and braces are covered at a reduced cost if you have the private supplemental health insurance. That is definitely one of the advantages to take out the supplemental insurances. The orthodontic treatments are considerably cheaper. Of course, autoimmune diseases are covered. Every disease that you would have covered in America or Canada is covered in Israel. Again, I've been asked about CPAP. It is covered. The machine is covered by the health fund. You can change it every few years. There is a very low co-payment of it. Now, I mentioned before, right at the beginning of my session, the best way to choose the health fund is really by where you're going to be living and which health funds are strong in the area where you're going to be living. You want to be somewhere where you've got the choice of a few family doctors, a few pediatricians, but also you might specifically want to work with a specific hospital. If you know you want to be able to go to Hadassah or Tel HaShomer or Shari Tzedek, it's worth checking which of the health funds work with which hospitals. Again, this is all written on the website. You can also send me an email and I will answer the question. Now, again, I've been asked here a question, will every Oleh have to be quarantined coming on Aliyah? We don't know how long this situation is going to be going on for. At this point in time, anyone who comes into Israel, there is no discrimination, whether they're an Oleh Chadash or if it's someone who is an Israeli citizen. There is an enforced 14-day quarantine in order to reduce the risk that he would pass on to anyone else in the community, coronavirus. I have no idea. I mean, if we'd have talked about this 6 weeks ago, none of us would even have known this was all on the cards. We'd have all been with you tonight and we'd have actually been presenting to you live. But things are dynamic and I believe we'll deal with the situation. We're not given things that we can't deal with and we'll pull together and we'll come out the other side better for it. Okay, we'll give it a few more minutes to see if there's any questions. We'll put up my email on the screen. It's T Cardash, T for Tanya, Cardash, C-A-R-D-A-S-H @gmail.com. I think you're going to be sent it in the text box at some point. Okay, I'll wait and see if there's any more questions. I hope it was informative for you. I hope it's given you a basic introduction to the system.
Somebody said, please answer my question. This person asked this question a lot of times. How do you get health insurance while on a work visa? 5 minutes. I told her I told her either through Bittach Leumi or through private health insurance, but keep asking.
Okay, I've been asked a question here about getting health insurance while you're on a work visa. This is something that you need to speak to your advisor in Nefesh B'Nefesh. Someone who is in Israel on a work visa, it depends which type of work visa they're on. They might have to get out private insurance, or they might have to pay into the system. It is only actually Israeli citizens who pay national insurance contribution and are entitled to healthcare. There are certain cases, depending on the type of work visa that you're on, that after a few months of being in the country, you will be entitled to health insurance. But there's not a question I can give an answer to, a general answer to. It's something you need to speak to the Aliyah advisor. It's more a question related to Bituach Leumi or national insurance than to the healthcare as such. Again, dental care, we mentioned it. Dental care for those aged 19 to 74 would be via the supplemental insurance programs. There you would find yourself getting discounted dental insurance. Thank you very much. It's been a pleasure to speak to you this evening. Keep well.